Care Central, brought to you by Central Baptist Hospital. Good evening. I'm Dr. Jeff Fox, host of Care Central, brought to you by Central Baptist Hospital. We're going to talk about a circulation problem in varicose veins. My first guest is Dr. Tom Schwarcz, a vascular surgeon whose specialty is dealing with this type of problem. Now, we all know what varicose veins is, or at least we do when we look at somebody's legs and see what sometimes is an ugly dilated vein. But tell us what truly is a varicose vein, or anatomically or medically. What is it?
Well, the varicose veins that you're talking about are veins that get very large because the valves that are supposed to hold blood from going backwards down the leg don't work. And so the vein gets very large, gets a lot of pressure in it, and opens up all the valves all the way down. You can have these very large, ropey veins all the way down your leg. And that is a medical problem because there are consequences to that increased pressure in the veins. You can get a lot of swelling, you get skin damage, discoloration of skin, and you can even get open sores and infections from that problem.
Well, now, there are ways to fix those veins. How do you know when you need them fixed, and how do you know who to go to get them fixed?
Sure. Well, if you have symptoms, pain, swelling, throbbing, aching, burning, itching, you'll know that it's time to be evaluated for treatment. The place to go for treatment is also very important because the technology has changed a lot in the last 10 years. We have gone from doing the open stripping operations to going to the minimally invasive procedures where you just make a little nick in the skin and either use the laser ablation, which means you burn the vein and make it scar down and go away, or the microphobectomy, which is taking the actual vein out with a little hook. All have no stitches, no scars anymore, which is very different than the good old days.
Now, the good old days, you used to have multiple incisions and take it out piece at a time and really didn't know if you were getting it all, and a lot of those people are still having problems today.
That's correct. In fact, the stripping procedure used to be blind. You didn't have any guidance. You picked out a vein, you tried to put something in it to take it out, and they really were stripped out. And we've even seen patients back in the office that had that procedure where the main vein was still there and they missed the main vein to get. So what we use now is duplex ultrasound, which is just using sound waves to map out which veins have the valves that don't function, so we can direct our therapy very specifically for each patient, because every patient is different.
You can get at the vein that's not working.
Exactly.
Now, you brought some pictures with you, and if we'll see, maybe we can get some up there so you can tell us some
Right, and those are pictures of patients before. You can see the large veins in the thigh of that individual, and after treatment, and usually to get complete treatment, you need both the endovenous laser procedure and the microphobectomy, but we can completely eliminate the superficial and the varicose veins that most people see and have symptoms from.
Well, describe the laser and you said microphobectomy, because those are different, more technologically advanced than what we used to know, or some people do as sclerotherapy, which is more cosmetic. You're more interested in terms of real actual treatment mapping and getting rid of the vein.
Right. The veins that have valves that don't function, the true varicose veins, are considered a medical problem. Even insurance companies recognize that, and they will authorize treatment. And with ultrasound, you determine which ones have the problem, and the treatment for the laser procedure is you make a little nick below the knee, you put the laser fiber up to the groin, which is usually where the first valve has a problem, and all the valves below that do too. We numb up around it. We do this in the office and then burn that vein, which you don't feel at all. It's causing it to scar down, go away, and can't fill with blood anymore. So you cut off that backwards flow of blood down the leg. If you have a lot of branches, you probably need the second treatment, which is the microphobectomy, which is little pinhole incisions, and you take hooks through those incisions and pull the veins out. And so you can completely eliminate the varicose veins you see on the leg.
And hopefully eliminate the symptoms.
Exactly. And you can definitely eliminate most of the symptoms. Now, there are deep veins in the leg, too, that may have valve problems. And you can't fix those because you have to have those to take all the blood out of the leg back to the heart. But all the surface veins, and the ones you usually see, and the ones that are most symptomatic, usually we can take care of very effectively.
And that works both medically and cosmetically. As we saw in the pictures, you get a better looking result.
Absolutely. You decrease the skin damage, you decrease the swelling, and a lot of people don't realize how many symptoms they have. They don't realize how much aching and heaviness that they may have, and when they have after the procedures, many of them will say, well, I didn't realize how many symptoms I was really having. My leg feels so much lighter, I feel so much better, and they're very satisfied with the treatment.
Okay, so they have the procedure, you bandage them all up, or they got to go home and go to bed for a week, or they working the next day? What's the
Well,
time
they're
frame?
actually working the next day. The laser procedure, we put on prescription stockings right after the procedure in the office, and they walk out. And we don't want them to do any heavy lifting or straining or workouts probably for 3 to 4 weeks, but they can go to work, they can do whatever they want the next day. And for microphobectomy, the same thing. We wrap up the leg with an ACE wrap for 24 hours. We take that off. Patients have to wear stockings for a couple weeks afterwards, but I've had many patients go back to work the next day after these procedures.
Well, if you don't get to the point where you have to have this procedure done, okay, what are some simple things that maybe you don't have a big vein like we saw in the picture there, you just have some little irritation? I mean, is there things you can do before they have to end up seeing a vascular surgeon?
Absolutely, and the simplest thing is that any swelling in the leg is bad for the skin. So the simplest thing to do is to wear a stocking that will compress the leg, and sometimes you need prescription stockings that really squeeze that fluid out of the leg. The other thing to do is elevate your leg as much as possible, and you can do that either at work or if you can, if not at home, certainly put your leg up to prevent the swelling from being persistent. If you have large veins, they probably need treatment, and you can't do much about it on your own.
Now, I tell some of my patients, some of the women who have varicose veins that are a little irritated, I tell them to wear support pantyhose, and they look at me like sometimes I'm crazy and it's hot. Does that really make any difference, or do you need the prescription support?
Every little bit helps, but the best is to use the prescription. And as you point out, wearing pantyhose is very hot, it's not very pleasant, and most of the damage you get to the skin and most of the symptoms in the leg are below the knee, so I'll frequently tell patients if you just wear knee-high stockings, that's probably okay to prevent the worst of the problems. And they're much more likely to wear knee-high stockings than pantyhose.
Now, you have a complete vascular lab that does all this. What's the importance of a vascular lab versus just your average cosmetic injection?
Well, the vascular laboratory is very important to map out which veins actually have valves that don't function well. And you really ought to have an accredited vascular laboratory that specializes in looking at valve function in veins. Many will look at veins to see if there are clots, but not that many will actually map out the veins that have valves that don't function. And you ought to look for accredited labs because you want to have certified technologists who are qualified to really examine your veins fully. And a lot of people don't do what we do in our office, because if you do a good job and you map out all the veins, you will actually have the best results because you can individualize treatment for that particular patient.
Both cosmetic and medically.
Yes, but especially for the patients who need the laser treatment or the microphobectomy.
Now, just a little takeoff on this. Some people worry about when they have the veins, they get clots in their veins. If you get clot in a superficial vein or vein close to the skin, it's painful, a little irritating, but it's not necessarily dangerous. Then you mentioned the deep system. You can have a clot, which is dangerous. There's some new treatments on the horizon for that.
Absolutely. For the surface veins, there really isn't much to do except put heat on it, take some aspirin or ibuprofen, and sort of tough it out. But afterwards, those veins can be removed or gotten rid of by either the endovenous ablation or the microphobectomy. For the deep system, it's different. The deep system is a danger. You need to have your blood thinned, and the newest treatment that has come out in the last few years is to actually dissolve those clots to completely clear them out. Because if you leave clots in veins, it will damage the valves, and then you'll have all the medical consequences of having valves that don't function in your deep system. And that is not something that we can treat because you have to have them. We can't get rid of those veins.
And treatment is dissolving the clot, and if you treat early and right, you may prevent long-term use of blood thinner.
Absolutely. Well, you still need to have some blood thinner after it for a while, but the main thing is you keep the function of the vein valves intact. And if you keep that function intact, you probably won't get the same amount of swelling or skin damage that many patients will have years later. You
see on the screen now that person's got a lot of superficial veins, a lot of swelling.
Exactly.
And with your treatment, you get rid of the swelling, get rid of the redness and the inflammation.
Right. So we improved this patient tremendously with microphobectomy. Even though he didn't have complete treatment, you can see his legs look much better, his skin is in better shape, and that's simply with taking the superficial veins out and wearing some stockings.
Well, you know, you've given us a lot of good information. You've given us a lot of good medical information, some cosmetic information, but it's important that varicose veins are more than just an ugly picture. It can be a medical issue, and there's ways to take care of it.
Very definitely.
Thanks for coming.